Hello, sorry for that false start, everyone, and welcome to this session on integrating animal health and welfare into the 2030 agenda and beyond. I am Henry Mance. I'm the Chief Features Writer at the Financial Times in London, and I'm delighted to be here moderating. We have a real panel of experts covering perspectives from law, policy, and science. And we're coming together to discuss these interconnections between animal health and sustainable development. And I think, we were all alive during COVID, so we all instinctively know those connections. We've all, I think, understood the link between our farming practices and human health and the potential win-wins, but also some of the potential trade-offs. So it's great to have 5 speakers who can cover off different aspects of this. We have Cleo Verkiel, Senior Scientist at the Stockholm Environment Institute, Adeline Manelli from New York University with a legal perspective, Christina Romanelli from the World Health Organization, and Rebecca Garcia, a veterinary advisor from DEFRA in the UK. And we also have Cynthia Shook, the Scientific Director of the Welfare Footprint Institute. So the way it's going to work is I'm going to hand over to the panelists one by one to give a 7-minute introduction. So they will speak with slides for 7 minutes each. Then we will have a chance for your questions. So please do prepare your questions. And there is a Q&A box, hopefully on your screen, where you can enter your questions. And we will try to get to those in the second half of the meeting. And we will wrap this all up within an hour. So first of all, I'm going to pass on to Cleo Verkiel from the Stockholm Environment Institute to kick us off on this topic of integrating animal health and welfare.
Thanks very much, Henry. Can I just check you can hear me? Great. Hi, everyone. It's great to be here with you all today. I'm going to give a brief preview of a report that Stockholm Environment Institute, together with New York University's Center for Environmental and Animal Protection, is excited to be launching next month on the sidelines of the UN Environment Assembly. And I'll be covering why sustainable development and animal welfare are intrinsically interlinked and why it's important to consider animal welfare in the context of sustainable development, how the current 2030 agenda neglects important aspects of animal health and welfare, and what are some potential pathways for improving integration of animal health and welfare in the 2030 agenda and beyond. So a brief note on terminology. When I'm talking about animal welfare in this presentation and also our report, I'm using the World Organization for Animal Health's definition, so the animal's physical and mental states, which is influenced by 5 domains, including nutrition, environment, behavioral interactions, which all affects the animal's mental states. So physical health is an aspect of animal welfare, but it's not on its own sufficient for good animal welfare. Another term that will come up a few times across these talks is that of One Health. So One Health is an integrated and interdisciplinary approach that considers human, environmental and animal health together and recognizes that these issues are interlinked and that you cannot consider these issues in silo. The UN's One Health high-level expert panel has also recognized that animal welfare is an important component of One Health implementation. So just as a starter for sort of a framing for this webinar, I think it's important to highlight that the 2030 Agenda for Sustainable Development does not pay a huge amount of attention to animal health and welfare. On the one hand, as you probably all know, we have this global agenda that is extremely cross-cutting and interdisciplinary, 17 goals, 169 targets that address a whole range of sustainable development issues. Some of these issues are very relevant for animal health and welfare, for instance, goals on biodiversity conservation or ocean conservation or clean water. But the 2030 agenda does not reference the well-being of individual animals. It contains its references to animals on a species level, which is obviously a different thing. Also, a whole range of animals is overlooked, including farmed animals, who Henry mentioned are very relevant, for One Health and the way humans interact with animals. Lab animals, companion animals, working and urban animals are overlooked. And key issues that are highly relevant for the human-animal interface, including zoonotic disease and antimicrobial resistance, get very little attention in the agenda as well. And why is this important? The 2030 Agenda, whilst we are not on track to meet many of its goals and targets, it continues to be the main global agenda on which countries have agreed, which helps us set international norms around certain priorities that we find important. It also really supports policy coherence by bringing all these issues together and showing how they are all interconnected, and their implementation requires consideration of interlinkages. The 2030 Agenda affects financial flows, data collection, and reporting. So the fact that animal health and welfare aren't fully integrated here does represent an important omission. And as Henry said, perhaps thanks to COVID, we're much more aware now than we might have been in 2015 of all these important interlinkages. So why this webinar now and why this report that we're putting out? It's because in 2030, it will mark the natural ending of the 2030 Agenda, raising the question of what comes after this agenda. The high-level political forum under the auspices of the UN General Assembly has been invited in 2027 to consider how we will advance sustainable development by 2030 and also beyond 2030. So a range of scenarios is possible there. But one suggestion that has come up a lot is, for instance, some type of extension of the 2030 Agenda, but also an updating to consider new and emerging technological, social, and policy issues, which could include, for instance, artificial intelligence. Wasn't such a big issue as it is now. And One Health as well is a very relevant consideration for this updating. So very briefly, this is covered in our report in detail, but why do animal health and welfare matter for sustainable development? Well, firstly, there's a lot of agreement that animal welfare matters for its own sake. From the scientific community, we're hearing more and more about the very many different experiences that animals can have, positive and negative. So it matters to them what happens to them. And global surveys also show that citizens across the world care about animal welfare and think it's important to make strong policies in support of animal welfare. Legislative developments are not totally following those citizens' sort of desires in that regard, but we have seen that the European Union, but also the African Union, for instance, have recognized animal sentience as important principles. Animal health and welfare are also really important aspects of sustainable development. So when we treat animals well, when they are healthy, this can help us reach a whole range of sustainable development objectives, from tackling poverty, improving nutrition, improving gender equality, addressing zoonotic disease and AMR. We'll hear more about that in the next couple of talks. And also treating animals well can help us tackle climate change through their ecosystem services, biodiversity loss, etc. So really, these issues are very interlinked. And finally, co-beneficial solutions are available where we can implement policies that support humans, animals, and the environment at the same time. Vaccination and animal health trainings, for instance, are an example of the type of activities that could support One Health in this way. That said, there is an increasing risk that interventions that we pursue, for instance, to mitigate climate change or to even address biodiversity loss, might end up adversely impacting many animals. We see it very clearly in the climate space, and Cynthia Shook in one of the later presentations will talk about that more. So luckily, there is growing recognition of the importance of animal health and welfare for sustainable development. If you haven't seen it, it's worth checking out the New York Declaration on Animal Consciousness, which sort of just talks about the wide spectrum of animals who scientists increasingly believe are conscious and whose needs matter in that regard. But also on an international policy level, we've seen the establishment of the One Health high-level expert panel at the UN level in the wake of COVID. We've seen efforts to address antimicrobial resistance highlight the importance of animal health in this context. Very recently, this year, the UN adopted a pandemic preparedness and response treaty, which also highlights the importance of taking a One Health approach that considers humans, animals, and the environment. And in 2022, the UN Environment Assembly mandated the UN Environment Programme to produce a report on the nexus between animal welfare, environment, and sustainable development, recognizing these key interlinkages. Unfortunately, that report hasn't been produced yet, but we think it would be a very important contribution to this conversation. So the reports that we'll be publishing will be published on the sidelines of UNEA. We're hoping to reinvigorate the conversation around animal health and welfare in the context of UNEP's work. Very briefly, Adeline will speak about it more, but the report identifies 3 pathways for integrating animal health and welfare more into UN Sustainable Development governance. So through implementation of the existing SDGs, through updates to the target and indicator level of the existing SDGs, and through consideration of a dedicated standalone goal on animal health and welfare. The report also talks about key sectors and policy areas that can really help to promote better integration of these issues in the UN Sustainable Development Agenda. So finally, just to close, in terms of next step, we think it will be very valuable to continue to integrate these issues into the ongoing work of a range of UN organizations, as well as international processes, such as of the Convention on Biological Diversity and the UN climate process, as well as the post-2030 discussions that I highlighted. For those of you who might be in Nairobi around the UN Environment Assembly, we'll be hosting drinks receptions on the 5th of December, most likely with the government of Cameroon, where we hope to bring together stakeholders on this conversation. And even whilst there are, of course, challenges around progress on the multilateral front, it's also really important to highlight that a lot of the recommendations in our report can be pioneered by individual countries, cities, the private sector, and civil society as well. So thank you, and I'll hand over to Adeline for more on the report.
Great, thank you so much. Okay, so thank you so much, Cleo, for that helpful introduction. I'm really happy to be part of this conversation today. I think Cleo's given us a really good overview of why animal welfare matters for sustainable development. So what I'm going to do in my couple of minutes is talk through some of the more technical aspects of our report, how countries can actually implement this work, and what the future adaptation of the SDG framework might look like. So as Cleo mentioned, there are 3 potential pathways that we've identified in this report for better integrating animal health and welfare into the Global Sustainable Development Agenda. So firstly, there are things that countries can do right now to integrate into existing implementation of existing goals and targets. They can also, in a future agenda, strengthen or introduce new targets or indicators. And lastly, the report talks through the possibility of adopting a standalone goal on animal health and welfare. So as far as pathway 1 is concerned, the question really becomes, why act now? So as Cleo had talked through, there's an increasing growing awareness of the links between animal health and welfare and the sustainable development. We know that they are central to things like public health, climate resilience, biodiversity outcomes, and other outcomes that are of global importance. That being said, the SDGs do remain the global framework through 2030. There are no negotiations currently underway. And so we have to think about what countries can be doing now, in addition to what a future framework might be looking at. And the key takeaway here really is that countries already have the tools to integrate a lot of these considerations into their existing national actions and efforts towards sustainable development. So let's take one example from the SDG framework. So looking at zero hunger, goal 2. So goal 2 already focuses on ending hunger, ensuring access by all people to safe and nutritious food all year round. It also creates a target to ensure sustainable food production systems and implement resilient agricultural practices. Well, we understand that there are strong links between animal welfare and health and both of these targets. And so governments in implementing these targets today can do things that can help support animals and their health. So, for example, for animal-dependent farming, they can support improved veterinary care, humane handling, disaster preparedness. And in thinking about the future, we can also be supporting transitions towards plant-rich agriculture and away from industrial agriculture, understanding that, animal agriculture tends to be harmful to the environment, can lead to biodiversity loss, can have adverse effects on our health through the introduction of disease and contamination of the environment. Pathway 2 looks a little bit more closely at the possibility of actually amending some of the targets and indicators in the existing framework. Now, this is, of course, assuming that that there will be a similar framework post-2030. But what we've done here is we've gone through all of the individual targets and indicators, and we tried to identify ways in which we could integrate new language that can better account for animal health and welfare. And so the question becomes like, well, why do this? Well, firstly, it helps to really increase visibility and policy coherence around this issue, especially in light of recent changes and our understanding around the science and in policy changes at the international level since 2015 when the SDGs were first adopted. It also enables a monitoring framework, and in doing so helps to promote accountability on countries for actually making progress towards some of these targets. And then also it will help to support international cooperation and through various means of implementation, capacity building in places where more resources are needed. So as an example, there are ways in which we could say adapt existing target language, as including maybe adding new metrics. So looking at SDG 1.5, target 1.5, this particular target aims to build the resilience of the poor and reduce their exposure, vulnerability to climate-related risks. This target is linked to the Sendai framework for disaster risk preparedness. And a very simple addition to the end of this target might be to include support for the protection of productive assets, which the Sendai framework defines as including livestock and other tools for agricultural production. And so looking at the indicators, all of the indicators under this particular target are a direct reflection of the Sendai framework itself. And so one possible new indicator that could be added that exists in the existing framework for Sendai but does not exist in SDG is to actually start looking and counting agricultural loss attributed to disasters and then disaggregating it by asset type. This could help us really understand what is the impact of disasters on working and farmed animals. And in doing so, we can better take account of these assets, which are critical to many of these communities. So another example, Goal 11, which focuses on sustainable cities and communities. Target 11 aims to provide safe and inclusive access to green and public spaces. We know that these spaces are also very important for wildlife. And so maybe we could add some language here that in addition to taking into consideration women and children and older persons with disabilities, we can also take into account the needs of local wildlife. And so looking at the indicators, a very simple indicator that we might be able to add to start tracking the progress of this target towards local wildlife is just looking at the proportion of natural habitat cover in cities. So in addition to amending the language of the existing targets, we can also be thinking about potentially adding new targets and new indicators. So for example, under Goal 3 for good health and well-being, here is an issue that is only very minimally covered in Goal 3 already, but we can really be thinking about, especially in light of the COVID pandemic and the increasing number of zoonotic disease emergence around the world. We can be thinking about ways in which we can prevent zoonotic disease emergence and transmission through measures for reducing risks at the human-animal interface. And so an example of some indicators that might be attached to this target include number of detected zoonotic spillover events, proportion of countries with operational zoonotic surveillance and response systems. Another example under Goal 8, which focuses on decent work, we can be thinking about how we can start moving towards a more just transition of the workforce, towards jobs that integrate sustainability, One Health, animal welfare considerations, including through all us providing support for the things that they'll need in order to make that transition. And so as a means of implementation target, we can be looking more at proportion of countries with strategies for promoting a just transition, or we can be looking at the official international support for actions supporting a just transition. And these are all just examples. We do provide additional examples in our technical supplement, so this is really just a sample of some of those recommendations. And so our third option here is to really explore a standalone goal. So what could a standalone goal achieve that could otherwise not be achieved through textual changes in the existing targets and indicators? So it could really help to elevate the issue of animal health and welfare to the level of other global priorities, especially in light of the recent One Health framework and its growing importance in the international community. It also will help to provide a more holistic governance framework for food systems, health, conservation, infrastructure, and all of the issues and sectors in which animal welfare touches upon. So what would a possible scope look like? Well, it's just a sample. We have identified a couple of key issue areas, which I won't get into in great detail, but I wanted to provide a bit of an overview here for you. So looking at various sectors like diets and food systems, fisheries and aquaculture, but also thinking about things like policy coherence, education, research and innovation. And then similarly, with the other goals, also thinking about ways in which we can support countries to implement these new targets. So thinking about financial and technical support, capacity building, multi-stakeholder partnerships, and data and knowledge sharing. And so with that, I will end my presentation.
Thanks so much, Adeline. And I'm going to pass over to Christina Romanelli from the WHO to talk to us from her perspective.
Thank you so much, Henry. Warm greetings, colleagues, and just a big thanks to the Stockholm Environment Institute for including us in this timely conversation, and very much looking forward to that timely report that's coming up. So what I'd like to do over the next couple of minutes is to really bring animal health and welfare into the center of the global and public health conversation, not as parallel issues, but as part of the architecture of health security, biodiversity protection, food resilience, and the SDGs, and all the great things, important elements that we've just heard about. So that perspective really aims to complement the global governance lens that Cleo set out and the SDG framing that we just heard from Adeline, and connect to that of other speakers. So one of the questions I'd like to begin with is, why does this conversation matter now? If you really look across the global health landscape and the major health challenges that we face and are grappling with today, so zoonotic spillover, antimicrobial resistance, food and nutrition insecurity, climate-related disruptions, biodiversity loss, the same drivers keep surfacing over and over, and they all share one feature. They emerge from the way people interact with animals and ecosystems. And we know that the interaction is being transformed, often degraded by biodiversity loss, land use change, intensive production practices, fragmented ecosystems, rising global demand for animal food sources, and of course, disrupted wildlife, livestock, human interfaces. And these pressures shape, in turn, animal health, welfare, and ultimately human health outcomes, often in ways that traditional public health frameworks are not really well designed to capture. So that's why discussions like today, those we're having here, matter, because recognizing these interconnections is truly fundamental to prevention, resilience, and sustainable development. So One Health, as defined by the OLEP, the One Health high-level expert panel, which was referenced and endorsed by WHO and our other quadripartite partners, so Food and Agriculture Organization, World Organization for Animal Health, and UN Environment Program, is really ultimately about optimizing the health of people, animals, plants, and ecosystems together in a much more integrated way. And as I believe Chloe mentioned, the OLEP itself also recognizes the importance of animal health and welfare in this definition. But sometimes we glide over some of those words and some of those terms, right? Like the word ecosystems, even though when ecosystems lose their integrity or biodiversity is eroded, we actually see pathogen spillover risks increasing. We also see disease vectors shift, nutritional diversity declines, antimicrobial pressures intensifying, and food security and resilience of food systems weakening. So for WHO, biodiversity, which includes the animals, the plants, and the ecosystems of which it's comprised, is not simply an environmental or an ethical add-on, if you will. It's an actual determinant of human health. It's an environmental determinant of health, and it directly shapes animal health and welfare, and just as it does ours. You know, we already know that 70% of emerging infectious diseases in people originate in animals, whether these are domestic, whether these are wild, but they don't originate in animals alone. They actually emerge, and I think it's important to bear that in mind, from the breakdowns in the relationships between these different dimensions, between people, animals, and ecosystems. And these are the failures that One Health seeks to address. And these failures themselves are accelerated by biodiversity loss, by the intensification of production systems, habitat fragmentation, erosion of ecological buffers. And when animals, whether again these are wild or domestic, that are living in these degraded ecological conditions or in crowded systems or in have disrupted migration routes or are affected by these altered landscapes, they simply can't sustain good health or welfare. And when animal welfare breaks down, health risks escalate again across the board. So, from a health standpoint, animal welfare is often misrepresented as an ethical consideration. And while ethics do matter, absolutely, poor welfare also signals, if you will, systemic vulnerability. So that higher disease susceptibility, that greater circulation of pathogens and greater dependence on antimicrobials and the increased opportunities for pathogen spillover and higher environmental contamination and decline, all of those matter, and all of those create that systemic vulnerability that we're speaking of. So in that sense, strengthening animal welfare isn't really a peripheral reform, right? It's actually a risk reduction and health protection strategy. Let me just turn very briefly, because it was mentioned, but to the pandemic treaty, which was adopted earlier this year by the World Health Assembly. And this truly was a historical turning point because it represents the first time that a legally binding instrument has integrated the One Health approach as a foundational principle for pandemic prevention, preparedness, and response. And I think one of its most important prospective contributions is that it helps to move that center of gravity upstream toward prevention at source. So that includes attention to the drivers that make spillover more likely, like land use change, wildlife trade, intensive animal production systems, unsafe interfaces between domestic and wild animals, and so forth. So what's significant for our discussion here today is that the agreement makes that prevention at source operational, not just aspirational. And how does it do that? It requires countries to develop multi-sectoral plans across human, animal, and environmental sectors to address the drivers of spillovers that I'd mentioned earlier, land use, biodiversity loss, etc. And they also very much directly align with One Health through Articles 4 and 5 and calling for surveillance at the human-animal interface, capacity building for joint risk assessments or joint workforce training, and supporting and implementing One Health policies that are actually grounded in evidence, so evidence-based. And this is precisely where animal health and welfare can greatly contribute because well-designed, well-regulated, and welfare-aligned systems can reduce the risk of pathogen emergence at its source. They can also make surveillance easier and more meaningful and support safer and more nutritious food systems while also lowering those pressures of antimicrobial resistance. So this really is a meaningful shift. And so I think that this ties in with the governance argument that governance of pandemics can really no longer just revolve around health commodities and clinical response or emergency protocols. It really has to go to those upstream drivers. One last point is that this shift also aligns with other global health governance reforms, including the 2025 international health regulation amendments, which rely on stronger intersectoral coordination and equity in access to health products, and the implementation of the quadripartite One Health Joint Plan of Action, which actually supports countries with legislative, institutional, and policy guidance. I think I may be out of time, but would be very keen to engage in other dimensions in the discussion period.
Great. Thanks very much, Christina. Great to hear. I'm now going to pass on to Rebecca Garcia from the UK's Department for Environment, Food and Rural Affairs, who's going to talk to us, I think, in part about the Sentience Act in the UK. Rebecca, over to you.
Thanks very much, and I'll share my presentation. So I will talk about a number of things, but I'll start speaking, linking up with Christina's mention of AMR about antimicrobial resistance and animal welfare. And what I'm going to try to do is to give you a practical example of how countries can implement and integrate animal welfare within different policies in a way that supports sustainability. So the example I've taken is antimicrobial resistance, which is a very key challenge globally for everybody. So just to set the scene, is a growing threat, and it's not just in the UK, it's just across the world. Reported within the UK, we have across the world 1.27 million deaths globally. The cost to national health services is millions, so it's a very high cost for everybody. That's the figure for the UK's NHS, 95 million per year. And out of all the deaths, 35,000 deaths are associated with antimicrobial resistance within the UK in a year. So if we take that within the global sphere, it's quite a large number of people we are talking about. So we know that antimicrobial resistance does not just affect people. It affects people, animals, and within us, it affects both our health and our welfare equally. So that's also having an impact if we look at livestock, at the food security and other areas. So it's really a good example that brings together how animal welfare is relevant, even though there is a very big health focus here. So I just wanted to mention in the UK, there is a 20-year strategy that actually has a series of ambitions on how to tackle antimicrobial resistance. And if you look right in the middle, we have Ambition 5, which embeds into this strategy protection of animal health and welfare, something that is seen as crucial when we are looking at antimicrobial resistance prevention and a reduction on the use of antimicrobials. So the most recent report on how to reduce antimicrobial resistance is the report you see on the screen, which was launched in 2024. And that's the current 5-year plan we have within the UK on how to confront antimicrobial resistance. So I will give you a very brief flavor of what is in the report, and you are all very welcome to look it up online and have a read through it. But basically, the key themes of the report are intended to reduce the need of an unintentional exposure of antimicrobials and antimicrobial resistance, to optimize the use of antimicrobials, and to invest in innovation, supply, and access. But also not just focusing on UK efforts, but being a good global partner, because obviously we travel across the world. We are all connected in this webinar across different countries, and bacteria and viruses will travel with us when we move around. So it's very important to be good global partners and to support everybody to ensure that this reduction does not just happen locally in one country or in one region, but it's actually that it takes a global approach and it's a global initiative. And it's also important to ensure that the actions are taken not just across the human health sector or the animal sector, but it has to be an all-encompassing approach. So comprising human health, animal health and welfare, agriculture and environment. That's why this cross-cutting approach is really key, because we can take action in one area, but if we miss the others, then we are not going to succeed. So integration of animal welfare is key for this. So I will just take one of these key theme priorities as an example. I will not go through all of them because we don't have much time today. But if we focus on one of the key themes, which is reducing the need for an unintentional exposure to antimicrobials, you see there are 3 different areas of focus within this theme. So we have infection prevention and management. And you will see I put there a little circle with AW, it refers to animal welfare. So animal welfare will be key here to ensure that we are preventing infection and we are managing infection. So by keeping animals under good welfare, keeping animals under good handling systems with good equipment, we are going to ensure that those animals are well kept and are actually having good immune systems that are going to help them to prevent becoming sick. So that's something very, very important that we don't often think about it. We just talk about the health and the animal health, but equally improving that animal welfare is going to strengthen and reinforce those animal health improvements and that prevention. So something to take into account when we think about infection prevention. Animal welfare improvements will support that and help us to reinforce it. We also have another area within this theme, which is public engagement and education. And again, we can have public awareness and campaigns, but it's important not to focus just with a tunnel vision on one area. If we truly want to have a cross-cutting approach, we need to be all-inclusive and integrate equally animal welfare. So if we're aiming for infection prevention, we need to ensure that people understand why animal welfare improvements are key. And that's where animal welfare comes into this section of public engagement and education, and not just limited to dissemination, but also education of people working with animals, ensuring they have the right capabilities, the right skills, and ensuring that they are equipped and confident on how to undertake those animal welfare improvements. So that again is key for a successful implementation of reduction of antimicrobial resistance. And then we look at strengthened surveillance. And there are huge initiatives of surveillance across the world and within different countries, looking at how we monitor diseases, etc. But we also are collecting animal welfare indicators for different reasons. So again, it's really important to start looking and paying more attention to the animal welfare indicator surveillance to see how that data can actually help make our surveillance systems more robust and ensure that we have a holistic approach to this. And I'd like to finish. I know there is a very quick gloss over the policy, but I would like to finish with something that is also very key for policies. If we are truly to embed animal welfare in a cross-cutting way across different areas, we need to also have an understanding and recognition that animals are sentient. So I just wanted to conclude with the Animal Sentience Act that was enacted in the UK in 2022. And this is quite, if you go online and have a look at the act, you will see it's quite brief. It's quite a brief piece of legislation, but actually it's undertaking a very key role with 4 key measures that I will mention just to conclude. Basically, it's providing recognition that animals are sentient. And by animals, it refers to vertebrates, to cephalopods, and to decapod crustaceans. It's establishing a power to create an animal sentience committee. And then this committee has then the power to scrutinize ministers' decisions with a view to publishing reports, giving views on whether ministers have properly considered the welfare of animals as sentient beings. And the
Rebecca,
aim is...
can I come in? Sorry, and just leave. Can I? Maybe we'll come back to this in the Q&A if we can. But just I want to get on to. I want to make sure we leave enough time for questions. So can I pause your excellent talk there and move on to Cynthia, or is there a final word you'd like to say?
Yes, I'd like to conclude by saying prevention is better than cure, and to actually say that good animal welfare is key to prevent unnecessary use of antimicrobials. I'm very happy to pick up the rest later. Thank you.
Brilliant. Thanks very much, Rebecca. And our final talk is from Cynthia Shook of the Welfare Footprint Institute. And please, to the audience, we're going to take questions at the end of this. So please put them in the Q&A box and we'll get to as many as we can. Over to you, Cynthia.
Hello. So can you see my screen? Yes?
Yes.
Okay. Thank you for the Stockholm Institute for organizing this very important event. So what I would like to talk about is something that might seem straightforward, but turns out so far to have been extremely difficult, which is how do we actually measure animal welfare in a way that allows it to be included in major policy frameworks like the UN agenda. As society, we've made enormous progress in measuring environmental impacts, economic costs, health outcomes, etc. But what about animal welfare? It's often acknowledged in principle, but it turns out to be left out of the calculation very often. So I'll explain briefly how this is a problem and what we can do about it. So we're constantly asked about how to balance competing priorities. So for example, food security, environmental protection, public health, economic growth, etc. But how do we weigh animal welfare against these other concerns when we can even express this welfare impacts in comparable terms to these other dimensions? So, for example, for every kilo of carbon emission averted or liter of water saved through a given policy, what is the actual impact on the welfare of the animals affected? I'll give you a concrete example. You've probably seen headlines like this one. So switching beef for chicken could reduce water footprints of diets. That is true from an environmental perspective. But what about the animals? You need many more chickens to produce 1 kilo of meat than cows. And also the life of these chickens is much worse than the life of cows typically. So in terms of animal welfare, there is an impoverishment, a substantial reduction of the quality of life with this type of policies. So in many policies, it is true that we have mutual benefits. So healthy animals are more resilient, they have lower morbidity, typically mortality, etc. We also have greater product quality, food safety, etc. But this is not always true. So there are, in some cases, some genuine trade-offs between economic efficiency, global health, sustainability, and animal welfare. They will not always align. So how do we value animal welfare? So how we place a numerical quantitative value on taxes and subsidies connected to different welfare standards, or what are the value of welfare benefits for each extra dollar paid, for example, by a consumer or by a government in higher welfare products, or how we value the welfare costs of given policies at local, national, and international levels, and how to prioritize really. How do we know whether to focus on pigs, chickens, or fish, or on specific factors associated with breeds in chickens or with the slaughter of fish? How can we maximize the cost effectiveness of policies? So to answer all these questions, we understood that a meaningful, quantitative, and comparable measure of animal welfare was needed to quantify and compare the magnitude of welfare impact associated with the different conditions, traits, policies, interventions, and to truly integrate animal welfare concerns into economic, social, environmental policies and decision-making at various levels. So the welfare footprint framework, which is the framework we developed at the Institute, was developed to address this gap. An animal welfare footprint is very much like an environmental footprint, a water footprint, a carbon footprint, a material footprint, in which you have a quantitative measure of the cumulative animal welfare impacts of any production system, practice, or activity. And what it does is to capture for your system, practice, policy of interest, all the welfare relevant impacts for the animals involved in this production chain from birth to death, from cradle to grave, in the system of interest. So very much like a life cycle analysis. So let's say we were interested in the welfare footprint of 1 kilo of pork meat. In this case, we would analyze the entire pork production chain for all animals involved in the pork production chain. So the market animals, the female breeders, the male breeders, animals eventually used as feed, in all life phases from birth to slaughter, taking into account all the welfare impacts associated with this production chain. So all diseases, all injuries, all deprivations, behavioral deprivations, eventual fear, positive behaviors and impacts as well, and to calculate these impacts into a final welfare footprint. And what it does is to use a universal measure of welfare impacts, which is time in affective states, positive or negative, of different intensities. So time is a universal metric. It's also used for analyzing human health and welfare, and it can be applied to any species really, so it can be compared. And for every experience that the animals have in a given practice or production chain, you analyze the intensity of the experience, the duration of the experience, and the prevalence. So how many animals are affected by a given disease, injury, deprivation, and so on. So one by one. And in the end, you have the cumulative effects of all the experiences put together in this practice, in this production chain. So this is the annotation system for a typical welfare footprint. You have cumulative time in negative states, cumulative pain, or positive states, cumulative pleasures of different intensities. And this axis here is the time in the different categories. So this can be compared across practices, across systems, across species, and it can be calculated per unit of animal products, so per kilo of meat, per liter of milk, per dozen eggs, per unit of environmental or health impact as well, per capita, per dollar spent, per GDP, per country. So you can really choose the denominator of the metric that you have. So to give you a concrete example, there has been some resistance to adopting slower growing breeds of chickens, which have substantially better welfare than these fast growing breeds, on grounds that they would increase carbon emissions. Of course, they live a little bit longer, they need more feed, so they would increase carbon emissions per kilo of chicken produced. So using this framework and calculating the footprint of these two different breeds of chickens, what we analyzed is that if we used EU carbon externality costs, we saw, and this was a work conducted together with Cleo here, we saw that it would cost less than 100% of a dollar in terms of carbon emission costs to prevent 1 hour of very intense pain for the chicken. So with the emissions that are equivalent to driving a car for 15 meters, we would prevent 1 hour of very intense pain. So this gives us the possibility of comparing all these different metrics in quantitative terms, in terms of impact for animal welfare. And this opens a number of possibilities in terms of quantitative comparisons and inclusion of animal welfare into very different policy frameworks. So thank you so much. And I guess we are on to questions.
Brilliant. Thanks, Cynthia. And just one quick question for you while I have you. How are you judging the intense pain or the pain suffered by a cow compared to the pain suffered by a chicken? Are you taking them one for one?
Yes, so for everything that we analyze, say a disease or a bone fracture, so let's say a bone fracture in a chicken, we will understand the stress physiology associated with a bone fracture in a chicken every moment in time. When the bone is fractured at the point of fracture, then all the cascade of inflammatory reactions.
But a chicken is the same as a cow, is it in... Or...
No. We have a fixed scale of intensity that goes, let's say, from mild to very intense. And to the extent that we can assign intense pain for a chicken, we do. But let's say we were dealing with a shrimp or a different species for which we are less certain that they can feel as intense pain as a cow. So our certainty to intense pain would reduce, so the level of intense pain would be lower. So we use existing evidence to inform our probabilities for the intensity of the pain.
Thank you for filling in. Great. So we have a chance for some questions. Do put something in the Q&A box if you have any burning queries for our panelists. I want to start, if I can, with Christina. And I want to ask you, we talk about One Health, we talk about all the connections that you've spoken about, and someone might leave this webinar or might go out into their Department of Environment and they might say, great, I want to put this idea into practice. And then they run up into the difficulties of doing that. Where do you advise people to start in terms of practicalities, in terms of One Health, and in terms of doing things which benefit both animal welfare and sustainable development?
Thanks so much for that question, Henry. And it's a really great question, actually, because we're consistently asked how to operationalize One Health. And I think that a lot of the speakers actually have already noted some of the entry points, some of the important entry points, but there are other clear actions. I'm going to try to complement rather than repeat very briefly. So one of them is actually connecting human, animal, environment, and food system institutions to plan jointly, to share intelligence, to share data, and to also coordinate surveillance efforts. That would be one really fundamental low-hanging fruit. Another one is to use actual biodiversity indicators as part of national health risk assessments. Because ecosystem degradation, I was talking about it briefly before, are also an animal, human, and One Health signal. So, and I'll give you an example of an entry point and an opportunity that's happening right now. For instance, the Global Plan of Action on Biodiversity and Health, which was adopted by the Convention on Biological Diversity just last year, it is a voluntary global plan of action, right? But it does also tie into the global responsibilities that we have under what is called the Kunming-Montreal Global Biodiversity Framework. And one of the things that they are doing now, that is happening right now, and to which WHO, along with many other partners, is contributing, and I'm sure everybody on this call would be welcome to more than welcome to contribute to, is the development of integrated indicators. So there is another imminent, I'd say, opportunity to do so. Another one is actually just strengthening welfare as part of health surveillance, but not as an afterthought, as something that's actually integral to it. Reducing antimicrobial reliance by improving husbandry, by improving the way we frame or the interventions that we make to improve nutrition and food security and the environmental conditions that are associated with it. Another one that we often don't think of and that often gets neglected is working with local and indigenous knowledge holders in ways that actually respect rights and governance, especially where they add environmental and ecological insights. I mean, there are strong dimensions of equity in there as well. Other entry points, aligning national strategies with the pandemic agreement, national health strategies, national biodiversity strategies and action plans under the AMR declaration rather than treating them as separate agendas.
And just a quick one, Christina, you talk about indicators. To what extent would welfare indicators and better ways of distinguishing between different policies, welfare impacts, such as the ones outlined by Cynthia, how do they fit into an international policy perspective? Would they fit?
They would absolutely fit. They actually fit right into the discussions that we've been having, right into that One Health, that expanded biodiversity inclusive One Health definition, right? And they would target prevention at source. And as each one of the speakers, one after the other, has really demonstrated, whether they've said it explicitly or not, and whether I've said it explicitly or not, an investment in prevention is infinitely greater than an investment in cure, right?
And yes, that's the point that Rebecca made.
Yeah, so it really is about prevention at source, and that's precisely where and how it would fit in.
Brilliant, help? Thank you. I just got a couple of minutes. I want to go back to Cleo and Adeline, who worked on this upcoming report. And I want to say, we've all seen difficulties in multilateralism and what can be agreed. And there's also the risk, obviously, that any sustainable development agenda becomes a long laundry list that's indigestible for policymakers. Cleo, to what extent are you optimistic that animal welfare will not just be sort of a demand too far, but actually is something that policymakers can get their hands around and say, right, this does have a place, this does deserve a seat at the table in its own right?
Yeah, thanks, Henry. So, of course, we know that we're in a very challenging multilateral sort of space at the moment, more challenging than in 2015 when the 2030 agenda was adopted. So there's a few recommendations our report makes that can be sort of implemented immediately, right? We don't have to wait for revision of texts for governments to think more about animal health and welfare when they're implementing the 2030 agenda at the moment, when they're directing financing towards SDGs, etc. They can consider, are there trade-offs for animal health and welfare, or how could we enhance animal health and welfare in the pursuit of X goal? So that's one thing. And I also agree with you that, of course, there is a risk of having this Christmas tree of different ideas and things that we think important. But in the case of animal health and welfare, I think it came across very clearly in what Christina and also Rebecca were emphasizing, is that it really is at our peril if we ignore this issue, right? It actually makes it much more difficult to achieve any of the other goals. And so it is really important to consider these issues in unison. In terms of what framework works best, whether there's some consolidation necessary, for instance, that's a broader question for policymakers. But I think it is quite clear that if we want to achieve sustainable development, we can't continue to ignore these issues as we have been.
And Adeline, if I can come to a final word, because we're out of time, but to you, we have a question here from, I'm going to say Lasse Brun, and which I'm sure is the wrong pronunciation, so apologies, but basically asking whether we can make this, that it's worth making this case around the inherent value of nature and animals. And I wonder how you see that developing in the policy sphere. I suppose one possibility is that I think the instrumental arguments for animal welfare have always been very present over past centuries. But obviously, policymakers go into a room, they're human beings, and they have in mind certain ideas about the intrinsic value of nature and animals implicitly, even if not explicitly. I wonder how you see that point coming across in any international discussions around these topics.
Yeah, that's a great question. And I guess, one of the key things that I've taken away in producing this report and in the work that I do on this topic is really understanding that while we can acknowledge the intrinsic value of animals, and we should acknowledge their intrinsic values, in and of themselves, we can also acknowledge that our health, our welfare are linked to animals and the environment. And so we should be thinking about them cohesively. And this is actually why I am quite optimistic about some of the even more transformative changes that we're suggesting for this framework. We're not starting from scratch. A lot of countries are already moving in this direction independently. We're seeing governments integrating One Health into national plans. At the subnational level, cities are adopting wildlife-friendly building and transport standards. Major food systems are beginning to shift towards more sustainable and humane practices. So there's already a lot of work being done, a lot of groundwork that's there, and I think that is really representative of this acknowledgement of the importance of animals and the importance of animals for our own health. And all of these changes that we're discussing today, they deliver multiple co-benefits. Policies that improve animal welfare tend to also reduce zoonotic disease risk and support climate and biodiversity goals and strengthen resilience in food systems, improve public health. When one intervention advances several priorities at once, it becomes a lot more politically and economically feasible. So even if there isn't a direct acknowledgement of the intrinsic value of animals, we are acknowledging that improving their welfare can have benefits for ourselves as well. And then, as far as implementation is concerned, countries aren't doing this alone. There's this huge growing ecosystem of support, UN agencies, regional bodies, national governments, researchers, civil society, private sector. We're all moving towards more integrated One Health aligned approaches. There's technical assistance and financial assistance, capacity building and data partnerships that are becoming more available. And in many areas, countries are very eager to learn from one another. So I'm pretty optimistic, and even in the absence of an explicit acknowledgement in the intrinsic value, that from the fact that there's already a momentum there, and these recommendations that we're making in this report really build on these existing trends, and the fact that they can solve multiple problems at once, and the partnerships that are needed, to really make them stronger than they've ever been.
Brilliant. Thank you, Adeline. And thank you for that note of optimism on which we can end. I'm sorry I didn't get round to all of your questions and to indeed offering them up to all of our panelists, but I want to say a huge thank you to all of our speakers, Cleo, Adeline, Christina, Rebecca, and Cynthia, and for all their perspectives. And for, as Rebecca mentioned, the UK Sentience Act is very short for a piece of legislation. So if you're looking for one thing to go and take a look at, then do Google that. And Cleo and Adeline's report is out shortly. Thank you all very much for joining us. It's been a pleasure to hear the perspectives. Thank you.